Muted.
Recorded, and it will be available to you within 48 hours of our presentation today. So with that, I would like to introduce today's presenter. Marissa Abbott is a California Epidemiologic Investigation Service Fellow at the California Department of Public Health. She is placed in the Safe and Active Communities branch and primarily supports the CDC-funded California Essentials for Childhood Initiative, a child maltreatment prevention project. Prior to her fellowship, Marissa completed her Master of Public Health degree at the University of Rochester School of Medicine and Dentistry as part of their 3-2 program. Starting this fall, she will return to the University of Wisconsin-Madison to pursue a doctorate in social welfare. So at this time, I'm going to turn my screen over to Marissa and hope that all of this works for you. And there she is.
All right, good morning, everyone. Hopefully you can hear me okay. I'm going to start by just giving a quick acknowledgement that not only is this webinar supported by Strategies, but it is also supported by a grant from the Centers for Disease Control and Prevention. So I just wanted to start by giving some background on the California Essentials for Childhood Initiative, which is a collective impact project that has led to our partnership with Strategies and serves as the basis for our work addressing child adversity. So Essentials is a CDC-funded child maltreatment prevention project that uses a social determinants of health framework. And social determinants are anything and everything in one's social, political, and economic environment that affects their health and well-being. Essentials is a partnership between the California Department of Public Health Safe and Active Communities branch and the California Department of Social Services Office of Child Abuse Prevention. And we work with several partners and initiatives in the community, including First 5 California, ACES Connection, the Center for Youth Wellness, the Department of Justice, and the Lucille Packard Foundation for Children's Health, among many, many others. So the CDC has 4 overarching goals for the Essentials for Childhood Initiative. And those goals are to raise awareness and commitment to promote safe, stable, nurturing relationships and environments to prevent child maltreatment, to use data and best practices to inform solutions, to create the context for healthy children and families through social norms, system changes, and program improvements, and then also to create the context for healthy children and families through policy. So as you can see, we're kind of doing a lot of different facets of work, from data to social norms and systems and policy change. And so you might be wondering, why the focus on child adversity? Well, child adversity, such as child maltreatment, exposure to violence or food insecurity, or things like family alcohol and substance abuse, has a negative long-term impact on the health and well-being of the population. Early experiences, both positive and negative, affect brain architecture, which provides the foundation for future learning, emotional development, behavior, and health. And the toxic stress that's associated with these negative experiences can disrupt healthy development and lead to serious health issues in adulthood, such as chronic diseases, obesity, and substance abuse. And I also wanted to mention resiliency before moving on to the next slide, because we are very interested in resilience. And resilience is an adaptive response to hardship that can mitigate the effects of adverse childhood experiences. It involves a combination of internal and external factors and is created and strengthened by safe, stable, nurturing relationships and environments within and outside of the family. And so the last piece that I want to mention kind of talks about these adverse childhood experiences as a whole. And I think the great thing about adverse childhood experiences, or ACEs, is that they provide the frame that makes trauma into an intersectional issue. So essentially, the way our world is set up is very sector-oriented. So for example, I work in public health, someone else might work in child welfare or education, etc. But the issues that we're talking about are all interrelated And so essentially, we should be talking to each other about these traumas. For that reason, I think that ACEs matter to everyone at the community and organizational level and serve as a great tool for bringing together different partners and perspectives to the table. And so now that I said, kind of why the focus on child adversity and resilience, I wanted to talk about the science behind ACEs and kind of what we know about how these experiences translate in the body. So child adversity includes a wide range of traumas that affect children and families. And there is a growing body of scientific literature that communicates the science of ACEs, or essentially, how do ACEs get under our skin? So to provide a little historical context, the original conceptual notion of ACEs was created through the CDC Kaiser Permanente ACE study and subsequent surveys that focused on several indicators of household and family dysfunction. And essentially, the study showed that ACEs are common and that they co-occur. But there are also several other pieces of ACEs science, including the neurobiology of toxic stress, or the brain science of ACEs, the health consequences of ACEs, so how toxic stress impacts our body systems, and then the historical and generational trauma component of ACEs, or the epigenetic consequences of toxic stress. So thinking about how do ACEs alter the expression of our DNA functions. And all of this research together has led to a growing awareness of the issue, aligns with many different sectors of work, particularly for those who work with children and families, but also at the population and community level. And the last thing that I want to mention before moving to the next slide is that not all adversity is bad necessarily. So at the individual level, all of us kind of have a threshold for how much adversity we can withstand. And when you reach the peak of that threshold, so when all of these multiple adverse experiences are building up, and it pushes you past that threshold, is when those adverse experiences become traumatic. So certain adverse experiences might be traumatic for some, but not for others. And that little bit of adversity in life is a good thing because it helps us become resilient and adapt to experiences in our environment. So I just wanted to, kind of stress that difference between adversity and trauma specifically, and how adverse experiences can become traumatic before moving on to the next slide. And so our data work group that was a part of the Essentials for Childhood initiative became very interested in promoting data on adverse childhood experiences to help communities make the argument for why adversity matters in their community. And so we partnered with kidsdata.org, which is a product of the Lucille Packard Foundation that seeks to bring together a multitude of data sources on child health and well-being in the state of California. And I'm sure some of you have heard of it or have used it. And so we worked with them to create this new data topic that we're calling childhood adversity and resilience. And as a part of that, we put up 3 different data sources: data from the Behavioral Risk Factor Surveillance System, the Maternal and Infant Health Assessment, and the National Survey of Children's Health. And the Behavioral Risk Factor Surveillance System is adult retrospective data, so it's adults that are reflecting on what happened to them when they were children, what adverse experiences they had. And that data is most emulative of the original CDC Kaiser Permanente ACE study measures. Then the Maternal and Infant Health Assessment data, or MIHA, comes from the Department of Public Health here, and it's the California version of the Pregnancy Risk Assessment Monitoring System. And they have a childhood hardship module that asks questions about adverse experiences, including things like, were you in foster care? And this survey is targeted towards postpartum women. And then the last data source that we have available is the National Survey of Children's Health. And that asks California parents about the current experiences of their child, so one child in their household, age 0 to 17, and includes a broader set of measures to kind of get at the adversity piece. So the idea behind putting up these 3 different sources of ACEs data was to expand beyond the traditional notion of ACEs that focused on household and family dysfunction to present a broader social determinants perspective of adversity across the lifespan, hence the name Child Adversity and Resilience versus Adverse Childhood Experience. So each data source has a different purpose, but together provides a comprehensive framework for understanding and addressing child adversity. Thus, these three data sources really get at this intergenerational component of ACEs, provide a broader perspective that looks at societal level causes of trauma, and reiterates the prevent, stop, mitigate, and recover notion that is central to developing resilience-based solutions to adversity. And so I'm actually going to walk through the data now as a resource that can kind of help you address this issue in your community. So hopefully this works. If not, I have it preloaded. Okay, perfect. And I'm actually going to backtrack for 1 second just to show you how you would actually get to this data on Kids Data. So when you go to the kidsdata.org homepage, you would start by going to Data by Topic. You would then click on Child and Youth Safety, and then you would see the Child Adversity and Resilience data topic. So I'm going to click on this Summary tab here, which is what the link in the PowerPoint goes directly to. So this is our overarching page that kind of is the summary of all of the data and narrative that we have on child adversity and resilience. And so on the side here are the different indicators with the high-level index and then the specific indicators that make up that index. So the top data is the National Survey of Children's Health. The second set of data is the Maternal and Infant Health Assessment. And then if it lets me scroll down, the last bit of data on here is the BRFIS data, or the prevalence of adverse childhood experiences. And so I'm going to actually click on that measure and then walk through the dashboard itself. So this is just the overarching index, or the prevalence of adverse childhood experiences, adult retrospective. And so the great thing about this data dashboard is that we have county level breakdowns for the data. So, and you can customize what the dashboard looks like. So for the purposes of this presentation, I'm going to clear everything. And just for example, I'm going to select California and Alameda, and let's do LA County. And so, you're kind of able to take this data and then compare it, not only amongst counties, but across California. And you can actually further go in and edit the data type. So let's say I want numbers versus percents, and then I'm interested in just households with children and only 4 or more ACEs. So I have the ability to customize my chart to meet my data needs. And so one other really cool thing before I walk through the narrative and continue with my presentation is there's this awesome download and other tools tab here. So if you click on it, you can actually take the graphics that you made, so the table, you can use a bar chart, you can create a geographic map or a pie chart, and you can copy that into a Word document, download the data into an Excel file, get a really nice PDF with some information about adversity. And then the coolest thing that I think is that you can actually embed the graphic into your own website or blog. And then every time the data is updated on kidsdata.org, that graphic will automatically update. So I think that, this really points to that Kids Data wants people in the California community to be using this information to help start a movement about child adversity and resilience. And so as we scroll down here, you'll see that there is a definition, source, and notes. So this kind of just tells you a little bit about the data itself, and make sure that the 3 data sources, while incredibly valuable and while presenting that broad perspective, should not be compared against each other because they are collected in different ways. So essentially, these data sources are just different ways of looking at how adversity affects communities. And so at the bottom here is what we call the narrative. And so the first tab here is the measures of child adversity and resilience. And this kind of goes through that background that I talked about in the PowerPoint on the 3 different data sources, what they mean together, and then how you would use them to make the argument for adversity in your community. The next tab is just related data that's available on kidsdata.org in case you're curious. The next tab, and we co-wrote this narrative as the Essentials for Childhood Initiative with the kidsdata.org team. But this tab kind of focuses on, why is child adversity important, and how is resilience a way that we can mitigate the effects of these adverse experiences? The next tab is how are children faring, and that focuses on actually using the data to explain what's happening in California. And then the last 2 tabs, one is policy implications and one is research and links. And I think research and links kind of speaks for itself. It's just additional resources that you can use to learn more about child adversity and resilience. But I think what's extremely valuable is this policy implications tab. So a lot of times when we talk about child adversity and resilience, people ask, well, what can we do about it? And what can we do about it at the community and organizational level? And so I think that, we came together and we really highlighted some high-level notions of how communities and organizations and structural systems can try to be more trauma-informed and really address and prevent the consequences of adverse childhood experiences. So if you aren't using kidsdata.org already, just in general, I would highly recommend checking it out as a resource. There's a lot of really fabulous child welfare data as well, and I think that you will find it usable in the work that you're doing in your community. And so now I'm going to go back to my PowerPoint. Okay. And so, now that I talked about why child adversity and how you make the argument for child adversity in your community, I want to talk to you about how you can engage and mobilize your community around the issue, and then how you would frame your message to kind of be the most effective message that it could be. And so the first step in engaging and mobilizing is identifying champions and leaders. And chances are, if you're listening to this webinar today, you are the champions and leaders that are interested in this and want to push the child adversity and resilience agenda forward. And so the next step is to organize supporters. So to get the people that you think will buy into the notion of why this is important and kind of form a collaborative around how we can work together to address it. And then the next 2 pieces, I think, kind of go hand in hand, but they are to create public awareness and then to hold public educational events in order to create a baseline awareness about ACEs in your community. And then the last piece that I, in a lot of ways, would argue is the most important part about engaging and mobilizing is that you need to develop specific asks to build institutional and community solutions. So essentially, when you're talking to the health system versus the schools, you're going to want to, have a different message about what they should care about for child adversity, because chances are they're going to care about different pieces, or different pieces are going to pertain to them. So you have to think about your audience, and you have to frame your message in a way that makes sense and helps you kind of move your agenda forward. And so now I'm going to actually talk about framing effective communication messages. And I'm going to preface this by saying that none of this is easy to do, and there's no necessarily right or wrong answers. So this is going to be a really high-level overview of kind of how you can use this ACEs information to frame your message, and how you can hopefully try to integrate values and facts. So, even though I presented all of this wonderful data and ACEs science, research has shown that the facts of ACEs science are not enough when messaging. And that's because values nearly always trump facts, especially when there are differences in opinions. So essentially, you can't simply throw facts at people to change their minds. Instead, in order to create lasting and widespread change, you need to change the dominant public narratives, or the stories, that shape how people understand and interpret their world to see what's possible. So I'm going to actually go through this information to kind of help you understand what the worldview and the public narratives are. And so I also want to preface this slide by saying that this is a brief overview of the lessons that we've learned from our work with the Centers for Disease Control and Prevention in the Essentials for Childhood program, and that these next few slides and content are adapted from a recent webinar by Marilyn Metzler and Colleen Yeakel on February 22nd, 2017. And so for the purposes of this conversation, I'm going to primarily focus on the worldview and the public narrative. And so the worldview is the set of values, beliefs, and assumptions that shape our view of the world. So it's the things that we take for granted, the stereotypes that affect our perceptions, and the things that we think of as common sense. So in a lot of ways, the worldview is kind of ingrained in who we are. And then public narratives are stories that shape people's perceptions, understanding, analysis, and sense of responsibility and possibility in the world. So essentially, a public narrative is a story that when told in different ways can shift public consciousness and change what people think is possible. So the public narrative is grounded in our values and beliefs, and it's more powerful than facts in changing outcomes. And so when I think about child maltreatment, for example, you might have someone that says, well, you know, child maltreatment is a problem of that family, and I have no need to intervene there because it's an individual family level issue. And so when you come in and say, no, we have a community responsibility to help that family, the person is not going to agree with that statement because their values are ingrained in their worldview and reinforced by the public narrative. So essentially, that person disagrees because they don't even realize that their values are being challenged. So when we think about how to effectively communicate about things like child adversity and resilience and child maltreatment, which is a part of those adverse experiences, we have to think about how to find a shared set of values, things that all people believe in or want to believe in as the basis for our messaging. And so when I think about the dominant narrative that exists for child maltreatment, and I do want to say that this is not an inclusive list. You know, there's many, many other things, but these are probably the 4 themes that we hear most commonly at the Department of Public Health. And I'm sure that many of you have heard others. But the things that kind of show up in the narrative are that child abuse is mainly a problem of the poor and other cultural groups, and that bad parents and children are to blame. And then furthermore, that parenting is a family issue. It's not a government or community problem. And that the child welfare and legal systems are not tough enough in addressing the issue. If they were tougher, we wouldn't have to deal with this as a problem. And so, you know, we might disagree with all of these things, and I would argue that, you know, child maltreatment is significantly influenced by a whole host of environmental factors. You know, we have to acknowledge that this is what a lot of people believe because this is the story that they're told and this is the story that's passed around. And so instead, what we need to do is create a new public narrative that's grounded in values and beliefs that support safe, stable, nurturing relationships and environments for all parents and children. So we need to propose another set of shared values that focuses on our shared responsibility and the possibility for proactive solutions. And so I'm going to talk now a little bit about changing the narrative. And so there's, you know, no necessarily right or wrong way to do this. And oftentimes it's really hard to identify what the narrative is and then what those shared values are for how you can change it. And so in changing the narrative, as I mentioned, we need to work with those alternative narrative values. And I think one of the really key things is we need to move away from this individual focus to a community focus. So we live in a society that's very much like you pull yourself up by your bootstraps to succeed. And while that's important and that American can-do attitude is a value, you know, a lot of these issues affect communities as a whole, and so we have to reframe them as community issues. And another part of changing the narrative is moving from reactive to proactive, and then promoting a protective framework that allows us to positively impact multiple social problems. So I think one good way to think about, these asks that we should be promoting is that we really need to try and maintain a good balance between solutions that provide direct services for children and families, but then also address those broader structural conditions and constraints that shape individual behavior through policy and environmental strategies. So the idea would be, to kind of select a group of strategies with a focus on preventing child abuse and neglect from happening in the first place, as well as also adopting approaches that lessen the immediate and long-term harms of child abuse and neglect or other adverse experiences. And so the last couple of things I want to mention with regards to changing the narrative is this notion of the counterframe. So I talked about, the narrative and kind of what the frame within that is. And so one way to kind of find that set of shared framed values is to focus on this American can-do attitude. So, we can all work together to create innovative solutions as a community to promote the well-being of children and families. And so it's kind of tapping into these values that people believe in American society and using them to your advantage. So a great example of a work that actually focuses on this great counterframe is the Raising of America documentary series that I highly recommend if you haven't seen it already. The signature hour really plays up on this American can-do attitude and how we can create those innovative solutions to move forward. So, I do want to say that none of this work is easy, and so it's perfectly okay if you're feeling overwhelmed and you haven't thought about it in this way before in your messaging and communication efforts. But, part of the goal of my presentation is to encourage you to think about these things because it's going to make you significantly more effective in the agenda and moving forward the agenda about child adversity and resiliency. And so the last thing I want to mention before I move forward and talk about some actual applied examples is two questions that we often get when we give this presentation. And so, to kind of address those concerns, because I think it might come up in the question and answer, but I might as well talk about it now. And so the first question is, can you give us an example of how you integrate values and facts? And so, the ACEs facts, as seen in that broader set of adversity indicators that I presented, support the notion that parenting is not simply an isolated family matter. Instead, the data actually suggests that the toxic stresses and traumas experienced by children and families are not only shaped by family history and the immediate family dysfunctions, but also by the cumulative past and present environments in which they live, work, grow, and play. So these adverse environments include unsafe and violent neighborhoods, poor quality education, persistent poverty, lack of opportunity, and limited job prospects. So the value of shared responsibility can be premised on the notion that we are all responsible for recognizing and addressing these unjust and preventable inequalities. So this premise allows us to reframe the dialogue from simply blaming the parents to looking at the potential structural and systemic ways that families are affected. So in this frame, the government or the local county agencies have an important role to play in addressing these inequalities and provide families and children with supports that they need to prevent, stop, and mitigate from adversity and toxic stress. So I recognize that that's a lot, so I'm going to just mention one other question before I move on to the applied examples. And the other question that we often get is, what are some sample messages grounded in values and beliefs that help shift from that individual to the community frame? And so some of those messages include, we all want the best for our children. Parenting can be difficult, and we all need help sometimes. Investing in children is good for all of us, and we all benefit if children succeed. The American can-do spirit should prevail that I talked about before, and then the focus on innovative solutions. So hopefully this information kind of helps you start to think about how you can do this, but I also wanted to go through some applied examples of what people have actually done, hoping that this information might be useful. And so I'm going to highlight an example from Butte County from Lead for Tomorrow and from the Baltimore Child Death Review teams, just to present an innovative example of ACEs screening outside of California. And so Butte County used the initial BRFIS ACEs findings from the Center for Youth Wellness Hidden Crisis Report to inform their efforts. And so you don't need to know all the specific jargon about that, but this hidden crisis document that they uses that same ACEs data that we have up on the kidsdata.org website. And so the great thing about this report for them was the ACEs data provided that frame to talk about trauma as a cross-sector and county level issue. And from there, Butte was kind of able to form a collaborative, so they identify their champions in their community, going back to my slide before, and organize their supporters in the form of this collaborative. And then they were able to educate county folks by leveraging existing relationships under a low-hanging fruit mentality. So essentially, in order to really create this baseline awareness about ACEs in their community and to ensure buy-in from different people, they used the relationships that they had to start those conversations and then to frame their specific asks depending on who they were talking to. So they had a general message about the burden of ACEs, and then they used that frame. And so from there, they were actually able to, kind of create this awareness and then implement a series of trauma-informed activities. And that's the stage that they're in right now. And so, some of their example county level solutions were that the school districts have adopted ACEs awareness resolutions. The First Five Commission has put ACEs into their strategic plan. And ACEs were also incorporated into the Butte County Public Health Department's community improvement model. And then what I think is the most exciting piece is that Butte County is in the process of implementing a Trauma 101 training with a champion model. So those champions receive the training and then go back to their organizations to further train the workforce about what it means to be trauma informed, and then also to even think about how our organizations actually induce trauma. And some great work that focuses on that is also the work of Dr. Ken Epstein from the San Francisco Department of Public Health and Trauma Transformed in the Bay Area. So, hopefully this example, while only touching on the surface of what Butte has done, kind of shows you how you can use that information that I presented on engaging and mobilizing to actually do this in your community. And as I said before, there's no right or wrong way to do this. Essentially, you just have to start somewhere. And it really comes down to finding those champions and focusing on those relationships. Those are the two biggest takeaways, I would say, with kind of starting this agenda moving idea in your community. And so I am cognizant of the time, and so I'm going to go through these next two examples kind of quickly. But the next example I want to talk about is Lead for Tomorrow, Family Hui. And so some of you might know this, but Lead for Tomorrow is the parent leadership grantee from CDSS Office of Child Abuse Prevention for 2016 to 2019. And they used the child adversity and resilience data that's on kidsdata.org to determine where to focus their programming efforts and to allocate their resources. And so from there, they were able to focus on several counties with the hope of reaching out to additional counties in the future. So this is just, like a high-level state example of how people have used this data to help them in their programming and planning efforts. And so the last example that I want to talk about relates to the child death review teams in Baltimore. And the reason why I present this is because it's just an incredibly innovative way of using ACEs screening and broadening it to a community level issue. So the Baltimore Child Death Review teams became interested in ACEs after learning that the odds of experiencing a serious injury in young adulthood increased by ACE score. And so what they did is they created a screening tool that combined traditional ACEs measures with these measures they call urban ACEs. And I'll talk more about what those urban ACEs are in a minute, but they really get at that broader social determinants perspective. And then the screening tool helped to create prevention recommendations that they use to mobilize their community. And so this is an example of their screening tool. And I do want to mention that this slide is adapted from Kathy Costa at the Baltimore City Health department. And so as you can see on your left-hand side, if you're facing your computer screen, there are the abuse and neglect and household dysfunction ACEs. And those are very emulative of the original ACE measures that relate to the Kaiser Permanente study. And then they also added these urban ACEs. So they've added neighborhood safety, bullying, witnessing violence, racism, and foster care, all experiences that I would argue, have a significant influence on the health and well-being of a child. And so, when a child dies, they go through and they calculate the ACEs for the child, both the original and the urban ACEs. And then if they have information on the caregivers, they're also able to calculate that information as well. And so the great thing about this screening tool is, when they're providing prevention recommendations for how we can prevent child deaths in the future, they're able to remove the individual level components. I guess not entirely remove, but think about those things, but then also think about the environment that the child is in and where we can really, align with what other people are doing in these areas to make our neighborhoods and our communities a better place. And so I think that this is just a really innovative way of looking at ACEs and kind of broadening them to a community level focus. And that's all that I actually have today. So sorry, I did speak relatively quickly, but we got started a little bit late, so I wanted to leave some time for questions. And I did also want to mention that, not only is my contact information on the slide and more information about the Essentials for Childhood initiative, but I also have contact information for individuals in Butte County and in Baltimore if you're interested in connecting with them and learning more about what they did in their community. So hopefully you find this information helpful, and I'm more than willing to answer any questions. Thank you.
Marissa, I would love to thank you for this wonderful, informative presentation. You gave some excellent resources and so much food for thought. We did have one question about whether or not these materials would be available to everyone. So you're okay with us uploading or downloading your PowerPoint presentation, correct?
Yes, I would love for this information to be shared.
Excellent. I want to allow a little bit of time if anybody has a question to go ahead and put it into the chat box at this point. We'll give just a moment for that to happen. I hate to move along too fast in case somebody is thinking about a question that they would like to ask you. I want to remind all of the participants that there will be a survey that will be sent to them following this presentation, and we appreciate your feedback in order for us to always improve our webinars. I want to thank Marissa for this wonderful presentation and for all of you for coming online, for your patience while we were working out the technical problems. So last chance for questions. If not, I'm going to go ahead and sign out and thank all of you for participating today.